So here on question 2, we basically asked again this year in 2024, have you seen the white fibrous clots? And look at that, John. 250 out of the 301 embalmers responding to this survey this year said they are indeed still seeing these white fibrous clots. So it's been up.
So it's actually gone up. So
yeah, it's gone up.
This was what time period was this, Tom? Is this for the whole year?
For the whole year of 2024, right? During the year 2024. Yeah. So Richard Hirschman and I have a couple of reasons why we think this might be happening. First of all, it could be that clots are becoming more prevalent, but we don't think that's happening. We actually think what's really happening is there is probably less of a stigma now for the embalmers to admit this phenomenon's happening, as they see it now into its 4th year, and they know from our previous surveys that more embalmers are starting to admit that these clots do exist. And as you know, I just sent you within the last week or so a couple of photos that Richard Hirschman took clots out of corpses in November and December of this year. So it's still happening. So then, obviously, if we go to the next question, you can see.
So this is question 3.
Yeah, how prevalent that the clots were. As you can see there, 27.5% of the corpses in 2024 contained the white fibrous clots. If you look over there, that's including the 43 embalmers that said they saw none. So even if you average those all in, you get a weighted average of 27.5% of the corpses containing the white fibrous clots in 2024. And that's up from 20% last year in 2023. So that kind of put a little dent in my Bradford Hill criteria theory of reversibility, because I was hoping to see the percentage of clots go down as we got further and further away from the medical interventions to something more like 10%. But it actually went up this year.
So 98 embalmers were seeing these white fibrous clots in between 1 and 20% of their patients.
Correct.
And 74 embalmers were seeing it in 21 to 40% of their patients.
Yes. And then if you look further on, 55 of the embalmers between 41 to 60%. So if you do a weighted average of all those, you get 27.5%. Now,
I did talk to a well-known embalmer in the UK just before we came on today, and he's seeing about 40%.
40%. Isn't that shocking, John? I mean, that's startling, isn't it?
So he'd be in that 41 to 60% bracket, roughly.
Yeah, and to remind your audience, like we said earlier, they never saw this phenomenon prior to 2020.
This is a completely new phenomenon. This is a completely post-2020 phenomena.
Yeah.
And as far as I'm aware, it hasn't been published in any journals of pathology yet, which is, I just find the inconsistency between the embalmer's findings and the pathologist's findings very difficult to understand.
It's very perplexing. Like I said, the funeral director associations don't want to talk about it. Vascular surgeons and cath lab workers don't want to talk about it either. And
of course, the processes of post-mortem autopsy that the pathologist would be involved in and the processes of embalming are completely different. So in embalming, you're washing out the whole circulatory system. Therefore, if there was any white clots present, they're going to be flushed out with the blood that's flushed out of the body. But pathologists don't do that, of course. They're just interested in the main organ groups. So it's understandable to an extent, but it still surprises me that there's been no reports I'm aware of in the pathologist journals. Have you seen any in the pathology journals, Tom?
I have not, Dr. Campbell. I have not. So it's and we know that there's when things are controversial, they have a hard time getting published sometimes.
It's difficult to explain.
Yeah.
And again, but part of the fact that more are being seen here could be a higher index of suspicion amongst embalmers now that this is more widely known.
And keep in mind, again, like I said, the mix of embalmers that took the survey this year is different than last year. The last year's survey was weighted heavily by the Pennsylvania embalmers. This year I had different states. So this could actually be this 27.5% could be a number down for them, right? If those people had answered last year, they may have said that they saw the clots in 40% of their corpses. So then it could be a reduction to 27.5% this year.
I mean, we can't possibly know that, but we certainly hope that it's a downward trend because. And we still don't know whether this is a peri-death phenomena or an entirely post-mortem phenomena? There's so many unanswered questions about this.
Well, the embalmers I talked to, Dr. Campbell, are pretty convinced it's happening prior to death for two reasons. First of all, they're picking up corpses that are only an hour or two old, and they're finding them riddled with the clots. And they say there's no way that those clots could have formed in just the hour or two since the person passed with no refrigeration. And then secondly, myself and a Dr. Philip McMillan over in the UK, who runs the Vegan Health Channel, we both have found whistleblowers here in the United States that work in cath labs. Mine's an endovascular specialist and cardiologist. And he says he's been seeing the white fibrous clots and pulling them out of patients, living patients, for the last several years.
Yeah, so the trouble is there's nothing published on that. This is the frustrating thing about this.
Yes.
We can't base... I don't doubt the guy's word at all, but we can't base it on anonymous anecdotal evidence. We need something in the journals. This is the frustrating thing here. I know you share this frustration.
I think that the government should actually subpoena these doctors to come forward and that may
there's a new administration coming in, Tom. Who knows what's going to happen?
Yeah, that actually the doctors might actually like that, because that might provide them some protection against having any retribution for being a whistleblower.
I think that's likely.
Right.
I suspect we're going to find out within the next year what's going on here, because of the more open approach to medical information that we're hoping for.
I'm very hopeful as well with
the next administration.
Jr. and in HHS, and then Dr. Jay Bhattacharya becoming the head of NIH.
Yeah.
Yes, we're seeing a new administration, and I'm hopeful too, Doctor.
Yeah, we're hopeful. Okay, should we go to the next slide, Tom? Yeah.
The next question I asked, because of the
slide 4.
Yeah, the confusion that we just had about the last one, about what's really happening. So I said to the embalmers, hey, did you see the white fibrous clots in a higher percentage or a lower percentage of your corpses than you did last year?
So this is the trend.
Right. And you see, it's the longest bar there is 155, say about the same.
Yeah.
But you can see that 59 said less clots in 2024. 47 though said more clots in 2024. So it all kind of balances out and averages out to about the same. So that's the conclusion I drew from that slide. Some of the embalmers in their comments, by the way, said, I haven't been keeping very good track, but I'm going to start keeping track like Richard Hirschman does of his corpses in terms of when they get the white fibrous clots. Richard actually tallies them, so he knows exactly what percentage he's seeing. And for Richard, by the way, it has been about the same that your embalmer said. About 40% of his corpses the last 12 months have had the white fibrous clots. So hopefully the embalmers will start doing a little bit better job of tracking that number.
Well, I mean, every time we do these videos, hopefully another couple of dozen embalmers will hear about it.
And they do. In fact, I actually get contacted by sometimes, that said, hey, I've seen your interviews with Dr. Campbell, and, I'll volunteer information. So that's a good thing.
And bounce it on to your fellow embalmers as well. We just want to collect as much information and data on this as we can.
Exactly. Question 5.
Slide 5, yeah.
And we asked, do other embalmers that you talk to say that they're seeing the large white fibrous clots? This is where I'm starting to get into the psychology of the embalmers a little bit, and the associations, trying to figure this out. As you see there, the yes bar is long, right? 185 of the embalmers do talk to other embalmers, and the other embalmers are saying they are seeing the clots. And as you see there, only 50 said no. What's interesting there at the bottom, you see 66 of the embalmers said we don't talk about this.
Yes.
Why is, are they not interested, or are they scared? Why wouldn't they want to talk to their other embalmers about this?
It's almost like, you and me know in the current climate, Tom, there's things we're not supposed to talk about. No one's written it down and says, thou shalt not talk about this.
Yeah, yeah.
Just in previous administrations or current administrations in the world, you're not allowed to criticize the leadership.
But it's just an indication that they do talk to each other for the most part in private.
So this is what I call coffee room chat. This is the sort of thing you talk about over coffee, isn't it, when you're having a break?
Yeah. God bless the few embalmers like Richard Hirschman and John O'Looney in your country that have come forward and they talk about this. And they've been much maligned for what they've said, too. The people come at them, but they have the bravery to do that. And, just think if like I said, this year's survey, 83% of the embalmers said they're seeing the white fibrous clots. Wouldn't you think how different would things be now, Dr. Campbell, if those people had all come forward 3 years ago to let us know what they were seeing?
Yeah.
Maybe a certain product would have been taken off the market by now. That's all I'm saying.
And it would be really nice to get, well, ideally all of the embalmers in the world to fill out this form. I mean, the better the data.
Correct.
There's no obvious reason to think that this is not representative.
Yeah.
Okay, should we go on to question 6?
We asked again about the microclotting this year.
Yeah.
We said, did you observe any of the microclotting? With the embalmers, they call it coffee grounds or dirty blood.
Yeah, it's very small blood clots that occur.
Yeah, and about the same number of embalmers this year, or same percentage, 78% said they were seeing the microclotting in 2024.
Yeah.
We're ready for the next slide.
And again, this is up from the previous, the 2020 and previous
Right.
year's numbers. Yeah.
And if you look at that note there, you're correct. Embalmers used to see microclotting in 2019 and the years prior, and less than 5% of their corpses prior to the years of, and particularly in patients or corpses that had gone through heavy chemotherapy. But so this is, if you look there, the average for the 2024 is 22%. If you average all those bars together, including the 52 embalmers over there in the green that said they saw none, you get microclotting still in 22% of corpses in 2024. And then this one is down slightly from the 25% that we recorded in last year. So that's following the Bradford Hill criteria of reversibility, that I expected to see.
And prior to this, we think it was about 5% of corpses had dirty blood.
Right. So as we know, this can be just as dangerous a phenomenon as, the white fibrous clots we think are causing strokes and heart attacks. The microclotting is just as dangerous because it occurs at the capillary level and blocks off the exchange of oxygen at the lungs, and then they carry that oxygen to all the major organs of the body, including brain, eyes, all over the place.
And as well as that, the microclots that come out in the embalming process could have been bigger clots that have been broken up by the pressure, the hydrostatic pressures generated by the embalming process.
Yes. So, we're seeing the white fibrous clots, like I said, this year in 27.5% of corpses, the embalmers are. They're seeing the microclotting in 22% of their corpses. Yeah. I think last year you had remarked, well, there's no reason why these percentages might not be a representation of our population as a whole, right? I don't know if you recall saying that. And I agree with you. It makes me think about what percentage of the population walking around right now may have these white fibrous clots and microclotting going on inside.
This is what I struggle with, Tom. I mean, if you had those kind of clots, say in your femoral artery, your leg would go black and drop off. We're talking about massive pathologies here.
Yeah. Well, you're right.
So something's not adding up. To me, it's pointing largely to a peri-death phenomena, but we simply need more information on that.
We need more information. I'm of the belief that the clots are small enough as they're growing that blood can still flow around them, and you feel fine. You may not feel any symptoms at all, but then it gets to the point where it finally then occludes a vessel, and then that's when you have trouble, right? When it grows large enough.
I don't know. I mean, if the vessel was partly occluded, you'd expect what we call ischemic changes.
Right. Well, and people have noticed things like fatigue, like that shortness of breath, brain fog. We're getting symptoms out there that could be representative of people that are not getting good oxygen exchange or good blood flow. And we've seen an awful lot of increase over the last 3 or 4 years in deep vein thrombosis, pulmonary embolisms.
Yeah, that's true.
And people, and my blood clot survey that we talked about a month ago, recall that. Some people died from the clot, but then there were other people that had the clot successfully removed. Some had clots that were actually broken up by TPA, and clot-busting drugs. Yeah. And then, so people have various outcomes.
The clot-busting drugs would only break up the red clots. It wouldn't break up the white ones.
Yeah, that's from talking to the vascular surgeon I was the cardiologist, endovascular specialist that I was in touch with. Most of the time, these white fibrous clots, they have to go in with flexible catheters that either scrape the clot out, lasso it out, or they suck it out.
Correct. It wouldn't respond to thrombolysis.
Right. Right.
Okay, so moving on to question 8.
Question 8. Have you ever watched any online videos such as Died Suddenly, YouTube, etc., like your interviews with me, or read articles concerning the large whitish fibrous clots? This one kind of surprised me too, John, because of the 301 people that answered the survey, only about a third of them said they've been watching these kind of things, and whereas 205, 2/3 said they have not.
You'd think there'd be more curiosity than that, really, wouldn't you, if they're seeing them?
Yes.
If there's something I don't understand or can't do, I go to YouTube to get the video. Like you can't change the battery in your clicky thing for your car. So you go onto YouTube and it tells you how to do it.
What even in last year and this year, when I called a lot of these here in the United States, the State Funeral Director Association presidents, and I would ask them often, have you watched Died Suddenly? A lot of them said they have never watched Died Suddenly, and it's just like, wow. That was done back in November of 2022. It's like, don't you? I'm sure they're hearing about this phenomenon. Wouldn't you think that they would want to have some curiosity in what's happening in their own profession? It just shocks me.
Yeah, you really would. I don't see any reasons why embalmers should be intrinsically less curious than pathologists. I mean, it's what they do all day, every day, isn't it? It's
yeah. So let's look at the next question.
No obvious explanation there. Question 9.
We asked the embalmers, are you a member of a professional embalmer or funeral director association? You see the vast majority are. Over 80% are members of a funeral director or embalmer association.
As you would expect.
Yeah, exactly. Yeah. So that takes me to the next slide. The reason I asked that question is the next slide.
Question 10.
Yeah. I said, has your professional embalmer or funeral director association ever discussed the large whitish fibrous structures clots? Look at that yes bar. Only 52 out of the 301 embalmers said, that's less than 20%, John, have said that their associations ever talked about these things, either in a annual meeting or a monthly newsletter or a quarterly newsletter. Again, I'm shocked about it, especially in light of the fact that 83% of the embalmers say they're seeing the white fibrous clots. You would expect.
There's much more chit chat from embalmer to embalmer than there is from professional association to embalmer.
Correct. In fact, that reminds me that this year again, in your own country, the British Institute of Embalmers declined to take the survey for the second year in a row, and it's just like, I don't get it. Especially, I know one of their own members. He's brought it up at their annual meetings. He specifically said, "Hey, are we going to take this survey that this U.S. Air Force major retired has been sending out, to our embalmer membership?" And they said at the meeting, they said they would take it up in their executive council. So they didn't decide at the annual meeting in front of all the embalmers. They took it to their executive council, and then they decided no. so it's like the embalmers don't get a say. The membership doesn't.
There's no confidentiality issue because it would be completely anonymous, Tom, wouldn't it?
Well, yeah. Again, the question I asked basically are, what are you seeing? When did you see it? And how much are you seeing? What percentage of corpses?
You can't relate this to a particular funeral home.
Yeah, exactly. So there's no privacy concerns here that are being breached. Yeah, strange.
Very strange.
Yeah.
Right. So I think we're going on to some embalmers' comments. So where did you get these comments from, Tom?
Yeah, at the end of all 3 of our surveys we've done each year, John, we always allow the embalmers, and it's optional. They don't have to respond if they don't want to, but we want to give an opportunity to tell us more about what they're seeing or not seeing in the embalming room as they're doing their embalmings. So I've got.
This is important because what we've looked at so far is quantitative data.
Right. So
now this is qualitative data, and that gives us an opportunity to triangulate.
Right. And remember, again, I never mentioned in the questions the words COVID or COVID vaccine. However, a lot of the embalmers in their comments, they talk about it, even though I've never mentioned it in the questions.
I mean, viewers may speculate on the cause of this, Tom. I couldn't possibly comment.
That's right. So we're going to read a few of what the embalmers.
Yeah, let's do it. Yeah, let's go for it. So Georgia, yeah.
Yeah, the state of Georgia. Majority of the cases of decedents I've embalmed who present the large white fibrous clots were in the age range from late 50s to early 70s. Microclotting and grape jelly type clotting have been observed almost on every case who have hospitalized prior to death. So I thought that was interesting. I would have expected more clotting in the like people in their 80s and 90s. So that 50s to 70s looks a little young for me. You know,
the grape jelly clots are bigger blood clots, which you could see those normally in the embalming process, couldn't you?
Yes, and embalmers have, and for years prior to COVID.
Yeah.
But they've noticed during the years of COVID and the vaccines that the grape jelly clots are more like grape jam now. They've become a little bit more viscous. Yeah.
The qualitative change.
Now, that last statement there that he makes about, you know, in almost every case who have hospitalized prior to death, that makes me tend to believe, is it possible then that the microclotting and the grape jelly clotting is the cause of the death in this person? You know,
or the cause of the hospitalization, at least. Yeah.
Right. Here's another one from the state of Kentucky. I've been an embalmer since the early 2000s for an embalming service. I've never seen anything like this before the spring of 2021. I have experienced the white fibrous clots that have stretched out to 20 inches. It's like battling a rubber band. My right hand and elbow has suffered from these clots. I've been saying for the last 3 years, this isn't normal. I've recently spoken with a physician that has been hearing this in his field. We are in the same agreement in that we feel we know where this has come from. I think they're talking about a certain medical intervention there. But
who knows? But it's interesting. This is what they're seeing.
Yeah, what's interesting about he's confirming again previous data that we've collected. You know, he said for him it started in 2021, and that's what the majority of the embalmers said in my very first survey.
Yeah, over half a meter in length. Yeah,
and then of course he mentions that not only has he seen it, but he knows a physician that says that he's seen it and is in the living as well. So that's interesting, I think.
It is indeed.
Yeah. All right.
Canada.
Next slide. Yeah, here we go. All right, here's one from Canada. He has a little bit of a different attitude, Dr. Campbell. Since the beginning of the COVID-19 pandemic, which I assume this survey is pertaining to, I have not noticed any clots, fibrous structures, or contents in the blood outside of the ordinary. It is also not our responsibility as embalmers to take note of these cases, record or share any information, as it is confidential medical information that breaches the privacy clause we have with our client families. Videos and articles such as Died Suddenly are anti-vaccine, COVID-denying propaganda that is based in no actual fact other than to spread right-wing beliefs and fear-mongering in the public. So this person definitely has an opinion. What do you think of that, Dr. Campbell?
It would appear that they are accepting the official government narrative and perhaps are less analytical and curious than you would normally hope. I agree it's not the embalmer's responsibility, but surely there would be a curiosity there.
You see, I actually take issue with that statement because I think that it is an embalmer's responsibility to bring this serious issue to the attention of the authorities. If you're Richard Hirschman, he wrestled with that. Because he knows,
it's true actually. If someone was admitted with a heart attack and the embalmer found a bullet hole in the stomach,
right?
Then presumably, I don't know the embalmer's code, but presumably they'd have to report that to the authorities.
In fact, according to Richard Hirschman, if they find like a bullet wound or a stab wound, they have a legal obligation to let the police know that.
Yeah, or any evidence of potential foul play.
Correct. So I think that like I said, Richard wrestled with this himself. He knows there's a privacy to the embalming room, but he also felt an obligation to himself, to humanity, that it's ethical for him to report these unusual white fibrous clots because he thinks it could be a serious threat to humanity. So that's what led him and John O'Looney and those others to come forward and talk about this. They wrestle with it because they understand the privacy of the embalming room. But as long as you're not talking about specific people, you're just mentioning, I've seen this phenomenon, and they've got proof of it, physical proof. They show that you've seen the vials of the clots.
They've got jars full of them.
Absolutely.
Yeah.
So